Hey friends, Jonathan here, and today we are going to be looking at what is probably the most common ache and pain, the most common thing that I hear about doing what I do, working with people and bodies, and that's going to be back pain. I mean, I think we've certainly all heard people talk about it. We probably know someone that has it, and for many of us, we've experienced some back pain either at some point in our life or sometimes even chronically. It just keeps coming back. Maybe it's fine for a while and then it shows up when you go to lift something and then it sticks around for a while and then goes away, or maybe you have it all the time. But today we're just going to be looking at, why do you have back pain? Where is that coming from? What is the probable origin of that? And then most importantly, of course, what are you going to do about it? How are you going to fix that back pain? So we're going to dive right into that. So let's look first at why your back probably hurts. Alrighty, friends, let's look at probable reason why your back might be hurting. Now, I should always say there's many reasons that a back might hurt. I mean, maybe you had an accident, maybe there's some actual different damage in there. You want to find out what's really going on with your back. But for the vast majority of people that just have back pain, it's really just more of a postural issue or more of an imbalance issue in your body. That if you address that imbalance, you will likely cease to have that back pain, or at the very least, really reduce it. So while this isn't going to be a cure-all to every kind of back pain, it's probably going to help you out quite a bit. Even if you've never had back pain, as I always say, make sure you've practiced this because it will make sure that you don't get back pain, and it's just really good for our body. Almost everyone I've come across has some of these issues. So let's look at why your back is likely hurting. So the reason that many people's back hurt is because you get what we call a tilt to the pelvis. So if you see my belt line here, there's what they call a posterior tilt, which is where I'm kind of tucking. I like to call it the sad puppy. And then there's what they call an anterior tilt, which is kind of the Donald Duck or the duck butt right here, right? We're doing this. Now, most of us don't walk around like this, but most of us do have an anterior pelvic tilt, and we'll talk about why in a moment. But what's important is that while you might not walk around like this is very awkward. What we do compensate then is we keep the arch in the back, but then you'll watch, I just kind of shift my pelvis forward, round my upper back, stick the head forward. So now I look pretty straight and more than this did, but I'm still getting that shearing force and compression down at the lumbar here. I can feel it right now, and that's not what we want. So what causes that? Well, a lot of people, when they go to address back pain, what they do is they do forward folds and they tell you to stretch your back. That is not what you want to do. The reason is because the reason that your pelvis is being pulled into this position isn't really because your lower back muscles are pulling it up. Although they may get tight in this process, the real culprit is what we call the hip flexors. So these muscles that run somewhat in front of the thigh here and kind of down the front of the thigh, they're what we call hip flexors. The reason they get tight is because you sit in a chair in this hip flexed position, they learn to be short. And then what happens is when you go to stand up and straighten, they want to bend at that hip. But since you're trying to stand up straight, what they do instead is they take the front points of your hips here and they pull them down. And that, as you can see, if I pull those hip points down, creates that arch. And then in order to create a little bit of stability, I push the pelvis forward into what we call an anterior pelvic shift. So this is probably why your back hurts. Now again, you might have some tightness in those muscles, you might get some temporary relief, but that's secondary. The real culprit is this, pulling this down, and that's causing that. So you can stretch your back and get something a little bit out of it, but if you don't address that hip flexor tightness, it's going to keep pulling that pelvis down, keep pulling those points down, and continue to create the whole problem in the first place. So the first thing that we're going to want to do is address that tightness in those hip flexors. And I'm going to show you guys here in this video exactly how to do that. The other thing we want to consider though, before we move on to what we're going to do about it, is another element in why it's happening. So as that happens, we sit on our butt, we stretch the glute in that seat, we're really sitting right on it, so the glute tends to deactivate, especially that glute max, the hip flexors get tight. So now we have the hip flexors pulling down, And that starts to also create a sort of lack of engagement, or a lack of ability to engage, or a lack of tension in the glute max. It also does the same thing. It tends to disable. If you see people when they stand in this thing, the belly will protrude out. It's because the transverse abdominis, the deep core muscle that is supposed to be pulling in and giving you a nice brace, has also deactivated. So we have tightness in these hip flexors, a little bit of tightness in the lower back, and that, because those things are pulling so tight, in a sense sort of disables the glute max and disables that transverse abdominis from doing their job. So really it's a two-part job. We got to loosen up, open up, or really rehydrate is what we're really doing, those tissues in those hip flexors so that they don't pull down so hard. And then also we have to make sure that we retension or rediscipline, in a sense, the transverse abdominis to stay a little bit in and those glutes to stay active. If we do that, then we'll take ourselves out of that shift, out of that realm that's causing the pain in the back. We'll pull the abs in, we'll engage those glutes, and you can see there is the difference between this and this. The length that we get through that lumbar and thereby the rest of the spine is going to really help. It's going to really reduce, if not get rid of, all that back pain. So that being said, that's what's causing it. That's why you probably have back pain. We're going to get next into what are you going to do about it, because that's really the most important part. So here we go. We're going to start with a little myofascial release. We're going to get down on the ground in order to do that. All right, my friends, here we are finally at the part where we stop talking about it and we start doing something about it. So first thing we want to look at is that the technique we're going to be using is not going to be stretching. I'm not just going to have you stretch your hip flexors. We've all done that. Back still hurts. What we're going to be really doing is trying to, again, like we said, rehydrate these tissues that have gotten dehydrated in some of these hip flexors. That dehydration causes them not to be able to move and slide and be as flexible as they should be, or mobile as they should be. So we are going to try to essentially use self-massage to try to rehydrate, to try to break up some of that dryness in there and get some fluid back into those tissues. So like we said before, the main culprit is going to be those hip flexors. For this technique, you can use a tennis ball. You can use what I have here, which is a lacrosse ball. For the first one of the spots that we're going to do today, one of the spots, sometimes I will use a PVC pipe, or you can even use like a metal water bottle, something that's cylindrical and firm and isn't going to, crush under weight. You're going to be putting your thigh on it. So I'll show you the first spot. And again, you can use the ball or the pipe for this one, but this first spot is pretty simple. The hip flexor we're going for is something called your rectus femoris. It goes from the point of your hip right here, that little point that sticks out. We call it the ASIS. It shoots straight down the middle pretty much to the patella, to the kneecap. So that being said, what we're really looking for is more in the kind of upper region of that thigh. We can sometimes find stuff down here, and you're welcome to explore that too, but what's probably pulling on the pelvis, giving you that trouble, is going to be up here. So really simple. Whether I use this PVC pipe or whether I use my ball, I'm just going to lay down on my belly. I'm then going to take this, whatever it is, the ball or the pipe, I'm going to place it under only one thigh. If you place it under both thighs, you probably won't get enough pressure to give yourself a result here. And then I'm just going to slowly kind of roll around on the front of that thigh until I find a spot that really gives a nice reaction. And by reaction, what we really mean is it's going to hurt a little bit, but we really want to specify that we are looking for that good kind of hurt. Like when you go to get a massage and they start rubbing on that tight spot and it hurts a little, but it feels good. That's the kind of quote unquote pain that we're looking for. So don't hurt yourself, but you do want to try to locate those areas. Again, the dry areas are going to hurt a little bit to put that pressure on. For some of us, if you haven't done this before, it might hurt even a lot. So you can leave that foot down. If you need more intensity, you can lift the foot up. And if you need more intensity, you can even start to bend that knee. But don't bring more intensity to it until you've started to get it to relax. If it still hurts a lot here, then what you're trying to do is just wait, maybe gently massage that spot, that dry, painful spot, until it actually gives you a reaction of breaking up. You want to feel that pain reduce or go away. You want to maybe feel some of those tissues in there actually break up a little bit. So whatever you need to do, bend, unbend, set the foot down, try to find that middle ground. You're looking for that, I like to call it the Goldilocks zone. Not too hot, not too cold, but just right. And then you just hang out there until that spot releases. Once you feel that spot release, of course, you can go up and down that thigh a little bit more, continue to explore that area. You can even kind of roll a little bit to the outside of the front of that thigh if you want to kind of rotate into it a bit. Just really exploring, again, any of that front of the thigh right here, especially the upper portion, all those things are going to be pulling that pelvis down in that way we don't want. So again, get in there, whether it's the ball or the pipe, find those spots, get rid of them, and that'll be a really good first step. Now our second step, this shot is going to be a little trickier, and we can only really do this one with the ball. Not going to really work with the pipe. You need to find that hip bone again. So the first one, it came from the hip bone, rectus femoris, came straight down the thigh. Now we're going to go up to the crest of that hip bone, and then I'm just going to go down and a little bit I'm going to follow under that crest line, I'm going to come down a little bit. It's what I like to call the jean pocket area. Like if you've ever worn jeans, it's usually in that kind of, especially for women's jeans, that little pocket up here, that's the area that we're kind of trying to look for. Again, right below, not on that bony process, but a little bit below it. And then I'm just going to take my ball, and you can even kind of feel around with your fingers until you feel something that kind of hurts. And then that'll give you a location. I'm going to then bring the ball down in front of me, laying on my side. I'm going to kick that top leg over, and then I'm just going to lay some weight into that. Again, using a lighter ball like a tennis ball will generally make this a little bit, less intense if that's what you need. Using the lacrosse ball makes it more intense. Again, don't go more intense until the less intense tool or approach actually starts to feel like it's not doing enough. You want to make sure that you're getting that Goldilocks zone. So this one's a little bit trickier. Again, you got to kind of explore around, but when you find it, you'll know there's kind of a little pocket. You kind of sink in there, and it'll really, if you've never released this, it's called the TFL, or the tensor fascia latae. If you've never released it, man, it'll hurt pretty good. But again, you just kind of wait, give it a gentle massage, and wait for it to relax, wait for it to open up. Of course, with all these things, you want to do both sides, and you want to be patient, because especially, again, if you've never done it, it can really take some time for these spots to start to break up. But again, if we don't get them broken up, then we're going to stay stuck in this bad position with our pelvis. It's going to affect your back and really everything else. So it's a little bit of hard work, but I assure you it is absolutely worth it. Now the last one that we want to approach, again, I said it's not really the lower back muscles that are causing the problem, but because they have been affected upon by that pull down of the pelvis, they are going to be tight as well. So after releasing some of those hip flexors, you may also want to move into what we call the quadratus lumborum, or this lower back kind of outer muscle. So not necessarily getting in close to the spine, although you can, but you really want to be careful not to go on your spine. Really more, I like to call it the love handle area. So you find that ridge of the hip as it comes to the back, and then just above, again, just right above the bone of that hip bone into that lower back outer area there. This one's super simple. You just lay on your back. I like to keep the knees bent. It just kind of flattens the back a little bit more. Instead of laying in this kind of arch, you can really get your back flat, which of course is good for your back in the first place here. Then we're just going to take that ball, I'm going to put it under, and then I'm going to start to tilt into it. I got lucky this time. I kind of landed right on the spot, but again, you might have to even readjust the ball manually with your hand. You really just want to find the spot, again, that gives you a tender reaction. If you need more intensity here, then whichever side I'm on my right side of my lower back, I'm going to take that right foot and just set it up on top of that knee. And that's basically, again, just stretching. I'm trying to kind of flatten. I'm almost trying to press the lower back into that spot so that I get really deep and I get that good deep release. Again, you're going to want to do both sides. It's the same principle. You find something that hurts, and then you just stay right on it, breathe through it until it stops hurting so much. And then, of course, you just move an inch or two over and you'll probably find another one. So those are the three main spots you're going to want to work on. Obviously, really ideally, we want to go through the whole body. We want to approach this more holistically, but I'm just trying to give you guys a quick little set of things that can start to give you some relief. So those are the three myofascial release or self-massage points that you're going to want to start with here. And then after that, we're going to get down again and we're going to start to retension. Again, we talked about the transverse abdominis and the glute max. I'm going to show you guys two really simple exercises and how to make them work better so that they really get what we actually want out of them. So hang tight, and we're going to get to that just next here. All right, my friends, here we are, last segment. We've figured out what was going on with our back. We've started taking the first step, which is to release those hip flexors, those lower back. We got to break up those things that are too tight. But as we start to break those apart, if we really want to solidify our result here, if we really want to make sure that it doesn't just slip back into that bad pattern, we need to create a new pattern. And that new pattern is, of course, going to be, instead of dumping out with the belly and relaxing the glutes, firing the hip flexors in the back, we're going to draw in, strengthen in the core of that transverse abdominis and strengthen those glutes. So two really simple exercises. And again, you can definitely and should definitely go from there. This is just a first step, you guys. But again, if you practice these things mindfully, you can still make some really good ground, and you might even be able to just fix your back right there. So first thing that we're going to do is we're going to do a very classic exercise. You guys have heard of it. It's called a plank. Now the problem is that most people, they use the plank as some kind of endurance exercise, like how many minutes can I do it and all this other stuff. We will not be using it in that context here. Here we're going to use it as what we call a corrective exercise, which means it's not about how long or about how cool it looks. It's really just about, are you able to get that engagement, to start to reaffirm that connection from the mind to the muscle of the transverse abdominis. So because of that, we're not going to really worry about time. And we're also going to leave our knees down for this one, because we aren't trying to make this into a difficult exercise. It's more of a mindful exercise, almost like a yoga exercise. I'm not trying to squeeze or push anything hard, just trying to mindfully engage. So that being said, I'm going to come down onto my elbows and my knees. Now the thing that you'll notice here is that I'm trying to get my back so that it doesn't sway. Again, that's our problem. Many of us will come here because that's where we started at. If you remember the standing up posture, we have this sort of sway to the hips, and that's why my back hurts right here. So I'm going to get rid of that, but we want to be careful we don't go into the round. This is the other side of the problem. We don't want to be stuck here either. So we're trying to get, like a plank, like the namesake of the exercise, as flat as we can through the back. And then once you're there, again, we're not trying to squeeze. What we want to be careful we don't do is crunch the abs, because now I'm rounded again. When I say you want to engage your abs, it's not a crunch, it's a draw in. It'll look something like this. I pull in, and I literally feel relief and openness in my lower back here. So sometimes I'll even kind of let it drop out and then practice feeling it pull in. So really what I like to think about is the space right in between your two hip bones. That kind of low belly is just suctioning inward, almost like you're trying to get your abdominal wall to vacuum seal over top of all your organs in there. And again, it doesn't need to be a really hard engagement. I'm not trying to squeeze it. I'm trying to find that place where I can really keep it in, really make that connection, again, that mind-muscle connection. What I really want is to be able to engage that transverse whenever I want, and to feel it take me into a longer spine. So watch what happens here in my lower back. As I plop the belly out, you see there's a slight bend at that lumbar. Now watch that lumbar extend as I draw in here. I'm going to pull in, and you can see that the lower back literally is getting longer, almost like my pelvis is sliding down towards my heels. And that's really important, because a lot of what causes us pain in our lower back is actually just compression. As all those things happen, as gravity pushes down, we're getting compressed, and those lumbar vertebrae are getting compressed. So you are looking, and you can even use a mirror, use a video like this, to feel and see that when you draw in, we want to actually see those lumbar vertebrae get longer. You might even be able to feel it. I've had plenty of people say that when they get it right, they even feel a couple little like kind of chiropractic little pops, like nice little releases as they take that pressure off. So again, don't do this as hard as you can or as long as you can. Do it as accurately as you can. Am I actually feeling lengthening and spacing out in those lumbar vertebrae? That's your first exercise. We want to really use that to get that transverse abdominis back online. The other side, literally, is the glute max. Now, many of us, we tend to compensate with a lot of other muscles so that we don't use the glutes. Again, we sit on them. We've sat on them for decades and years, school and cars and everything else. They are very dormant. We don't have a very good, in general, mind-muscle connection. So that's what this one's about again too. We've seen this exercise before. It's just called a glute bridge. We've done it in yoga. We've maybe even done it in some fitness classes. I know I use it, but here again, we're not using it to try to wail on the glutes. We're not trying to get a hard workout. We're not seeing how high we can lift our pelvis. We're trying to get good, solid connection to the glutes so that when you want to engage them, you can. So it's that, again, mindful exercise. I'm going to lay down. I'm going to get my feet, as you can see, a little bit ahead of my knees here. I might even put a little extra weight into the back edge of the heels, make sure those are connected to the earth. Sometimes that connection can help. But really get your back flat. Now what we're going to start with, before you go flying all the way up, and don't fly up. We're not trying to create an arch. See, this is, again, I'm shearing my lumbar. I'm doing the same thing that was causing the problem here by coming up too high. I'm not even using the glutes. I'm using the lumbar there. We don't want that. So what I suggest is first, just lift your hips just an inch or two off the ground. And then instead of trying to thrust your hips up, just see how much you can engage your glutes. Again, if you watch what happens here, watch my lower back, as I get my glutes engaged, core draws in, and my lumbar gets longer. So that's what you really want, especially if your goal is to just fix your back, then you want not even lifting that high. Notice I'm not even going all the way up to straight. I'm just thinking, mentally making a connection. Can I feel my left glute activate? Can I feel my right glute activate? Can I feel the vertebrae? Can I feel my lower back, lower vertebrae actually getting longer? It'll feel good, like you'll feel there's space being created between them. And then if you want to try to go up a little higher, you can, but just be really mindful. If you feel pressure at the lumbar, then you're causing the same problem that brought you here to this video in the first place. So stay lower if it gets you better glute. And again, you can even draw on that transverse here and keep that connected. And then whenever you're ready to come down, just come down slowly and feel like you're slightly tucking your tail. When you get to the ground, really feel that lower back spread, flatten. Again, that's generally going to bring in the core, but feel that openness, feel that length through the spine, and then that's it. So using, of course, the myofascial techniques, those releases, is going to be really, really key. That's the first step. If we don't get those released, you're going to be in trouble. You're not really going to be able to get these other two things to engage that well. But we do need to get those engagements as well. So even just turning this into a little daily routine where you get down and you work your 3 release spots and you do your 2 exercises for a couple sets. And again, those exercises, don't try to turn them into endurance. If you have to come up and the best you can do is just holding that core in for 10 seconds and then come down, or holding those glutes for 10 and then coming down, that's fine. Just do extra sets, do extra repetitions, because we're just really trying to get those muscles awake again. We're trying to get good control of them. So don't squeeze, otherwise you'll probably just use the wrong muscle. Just be mindful. In that plank, feel it draw in. In that bridge, feel the glutes engage. Over time, as you get these 2 structures, the transverse and the glutes, working properly, and you start to relieve that tension in the hip flexors in the back, you will feel a change in your body. Like I said, even if it doesn't fix your back pain altogether, even if you never had back pain, you will still feel better. Getting that decompression through that lumbar is super important, you guys. So I just wanted to make this video because this has been, again, the most common thing that I get hit with is my back hurts, my back hurts. People don't even ask me, I just see them. I hear it all the time. So this is one of the best ways that I've found to fix your back. It's going to require some work. It's going to require some discipline. It might not just work perfectly just by doing this one time for a couple minutes. But if you follow this regularly and you make this again into a discipline, you will notice that you're going to get that length in the lumbar, you're going to get that strength back into the core and the glutes, and you're going to feel a whole lot better. So this has been Jonathan. I hope this information has been very helpful to you. But again, no information is helpful if you don't actually do the things. So if you really like this information, you can click like, you can subscribe down below, whatever. But what I really would like you to do is, use it. Find the benefit, fix your back, and feel better. So that's it, my friends. You take care. Have a wonderful day out there. Do the work, and you will feel better. I'll see you all next time. Peace.